Hi. As you can see by the tree here, it's around Christmas time, and Christmas time is a time to where people get together and celebrate. It's a time where people are usually happier, more joyous, but it's also a time where people are sad and sometimes they feel a little depressed. And sometimes this is because they may be rejected from groups or social settings. And one of the groups of people that I'd like to talk about today in particular are adults who have ADHD. And I'd like to talk about why adults with ADHD may be secluded and rejected from social settings and why they may be social outcasts. So what is ADHD? Begin with what it stands for. It stands for Attention Deficit Hyperactivity Disorder. And the Neuropsychiatric Disease and Treatment defines it as a neurodevelopmental disorder expressed primarily by the distribution of attention over many stimuli without the ability to focus on single stimulus for a period of time. Many of you may ask, what does that mean? Well, it means that adults who have ADHD have a hard time focusing on more than one thing at a time. And ADHD can be one of the most common mental disorders of children, but it can also affect adults alike as well. And the symptoms can be the same in children as adults, including hyperactivity, impulsivity, inattention, and the inability to focus. So I'd like to move on now to talk about the causes of ADHD. The definitive causes for ADHD have not yet been found, but what studies do know is that biological, psychological, social, and sociocultural factors have all been linked to ADHD. Researchers at the American Psychiatric Associations and scientists have also found that ADHD is highly heritable, finding that 3 out of 4 children have been linked to their parents who have ADHD or a family member that has ADHD or symptoms of ADHD. So now I'd like to move on and talk about the social problems that adults with ADHD face. And the adults with ADHD usually tend to have possible impulse behaviors, so they tend to blurt out sometimes the first thing that's on their mind, that if you have the impulsive type behaviors, and that, for example, if someone walks into a room, an adult with ADHD, if they walk into a room and it doesn't smell very good, they could suddenly say it stinks in here, not thinking that somebody may have body odor or something like that. And a regular adult may think ahead of that, and they may not want to hurt people's feelings. So that can push people away. They also have a tendency to argue, which can also push people away. But what adults with ADHD tend to argue about most is they tend to argue about justifying their point or why they've acted the way they've acted, said what they said, did what they did, or even felt the way that they feel. Adults with ADHD tend to misjudge one's reactions. Therefore, they may feel at times they are being liked by someone or a group of people, when in reality they are not. And studies show in an article, Adult ADHD and Substance Abuse, written by Aparna Kalbag and Francis Levin in the Journal of Substance Use and Misuse, that adults with ADHD, compared to the average adult, have higher levels of anxiety, rejection sensitivity. They are twice as likely to abuse alcohol and illegal drugs, and they're at higher risk for depression and suicide. So I'd like to talk to you now about the facts about awareness to date. And until recently, adult ADHD was not included in medical school curricula or postgraduate medical training. So therefore, many healthcare providers are unfamiliar with the diagnosis and management of ADHD. And as a result of proper training or awareness, clinicians treating adults may be more familiar with diagnosing mood or anxiety disorders rather than attribute the presenting symptoms of ADHD. And I'd like to talk to you now about why it's important in bringing awareness, or what we can do to bring awareness. Awareness is a key factor to help social challenges adults with ADHD face in today's society. And more awareness in the workplace will help give people a better understanding of adults with ADHD and how to cope with their coworkers, or how to better help deal with situations. It's also important for adults who have ADHD to have resources to go to for help. Awareness also needs to be readily available at physicians' offices. More physicians need to also be fully trained and prepared on adult ADHD. More public awareness needs to be brought to light on adult ADHD. There are so many people that know that there's something wrong with them, but they aren't aware of the many symptoms of adult ADHD, and they need to have more awareness brought to light, letting more people know that they are not alone, shedding more light on the signs and symptoms, offering more resources and help. By bringing more awareness to the subject of adult ADHD and why adults who have this disorder, why they are the way they are, act the way they act, and think the way they think, it is conceivable that they may not be perceived as the social rejects they are in today's world. If the world does begin to understand adults with ADHD a little better, then maybe one day these undervalued individuals will be less unbalanced compared to the average adult and not considered some of the social outcasts they are today. People fear what they do not know, and they also fear people that are different from themselves. And I'd like to share with you today that my name is Shanna Whitworth, and I have adult ADHD. Thank you.